This 3-minute presentation will show you the rationale behind my dissertation topic. The easiest way to show you my ideas is via the concept map I recently created. In the center of the map, you find Improving the Fitness of Middle School Students. First, I ask, why would we want to do this? The first reason is that fitness declines between 5th and 8th grade more than in most other age brackets. The second reason I want to improve fitness levels in children is that children who are fit also tend to increase their weight and their obesity levels drop. Childhood obesity rates are rising each year, as are the costs of obesity. Further, obese children tend to become obese adults. The psychosocial impacts of both not being fit and of being overweight or obese include low self-esteem and low self-efficacy, and there are some links to depression as well. The benefits of improving fitness for middle school students include improving fitness, which has become associated with lower health risks. It can also potentially lead to a reduction in both the obesity rate and the costs associated with obesity. Further, self-esteem and self-efficacy can improve, and we might see reductions in depression as well. Finally, the goal is to create fitness mentors and lifelong exercisers. So going now to the other side of the concept map, in order to improve the fitness levels of middle school students, we're going to use the how. We are going to implement short sessions of high-intensity interval training to a select middle school students enrolled in physical education classes. Each high-intensity exercise session will be taught by an exercise science college student mentor. This student will attend PE classes at least 2 days per week. The groups will rotate through the high-intensity interval training session and the stations that are created to teach the traditional PE lesson to the students. By pulling a few students out from the traditional lesson, the skills in the lesson might be learned better as well, because there will be more opportunities for repetition. Finally, before beginning the high-intensity interval training sessions, the students will complete the standard fitness assessment utilized in South Carolina physical education classes, the FitnessGram. This assessment measures for healthy fitness zones. At the end of the 8-week intervention, the students will do the FitnessGram assessment again to see if they have reached more healthy fitness zones or higher levels within the zone they were already in. Getting more students into the healthy fitness zone is the ultimate goal of this intervention.